In people's opinion, problems with the brain are among the most complex and frightening diseases. However, by knowing the very first symptoms, we can prevent the development of these diseases. I'm Dr. Vasyl Chaika, and in this video, I will tell you about the very first signs of brain dysfunction and what you can do to prevent the onset of these diseases. Our organ, the brain, is located in a very well-protected place. It's inside our skull. And some interesting facts about the brain are as follows. First, it is made up of 60% fat. That's why we need to replenish our fat reserves daily so that our brain functions optimally. Also, the glucose in our blood enters the brain directly without the need for insulin. It enters the muscles with the help of insulin, but goes directly to the brain because the centers of control are located there. And the most crucial feature of our brain is that it has no pain receptors. That's why neurosurgeons can perform brain surgeries without anesthesia. In fact, there are two groups of problems associated with the brain as an organ. The first is the traumatic group of problems when there is some kind of trauma, be it barotrauma or another mechanical injury, where the brain itself is damaged by some physical force when it strikes directly against the wall of our skull. And there are non-traumatic disorders. Both types will actually manifest with similar symptoms, such as headache, dizziness or loss of consciousness, memory impairment, and also other specific manifestations, which we will discuss with you now. And it's important to remember that our brain directly controls our entire physical body. That is, our body contains approximately 70 to 80 billion cells, which combine to form tissues. Tissues combine to form organs, and organs combine to form systems. For example, the respiratory system or the digestive system or the urinary system, and these systems do not control themselves. These systems are controlled by our brain. That is, there are areas in the brain that control not just organs, but even certain groups of cells. For example, if we take the liver cells themselves, the hepatocytes, are controlled from the brainstem, while the bile ducts, which are lined with squamous epithelium, are controlled from the cerebral cortex. We can also take another organ, for example, the airways, the alveoli of the lungs, which are directly responsible for capturing air, are controlled from the brainstem, while the mucous membrane of the bronchi is also controlled from the cerebral cortex. The brain makes decisions automatically, and we cannot consciously influence it. What does this mean? In other words, we do not choose which reaction to select. How does the brain make decisions? It does this based on the receptors through which information is received. This happens through sight, hearing, smell, touch, tactile, and emotional sensations. And depending on what information comes through these channels, the corresponding center in the brain responds, or rather is activated, and the parameters of our physical body change. That is, when we see danger through the visual or auditory analyzer, the brain automatically chooses the reaction we should take. For example, we touch a hot frying pan. We don't think about what to do, we pull our hand away. When we see an enemy, for example, we don't pull our hand away. We either run away or attack. But the brain, like any other organ, can, let's say, show signs of changes in how it works. So let's go over these signs together. So the first group of conditions, as we've already discussed, are traumatic ones. And this kind of situation often happens. A small child, for example, was playing on a couch or a bed and then, oops, rolled off the couch and hit their head on the floor. And certain changes appeared. Or, for example, a boy was riding a bicycle, fell off and hit his head. Or, for instance, an adult could also slip somewhere and hit their head, and they develop certain symptoms. Which ones? First, it could be dizziness or loss of consciousness lasting from a few seconds to several minutes. Usually it does not last more than 10 minutes. After this, there may also be nausea with vomiting, as well as coordination disturbances and headache. That is, all these symptoms indicate that there is a mechanical injury, and of course we have the very fact of this mechanical injury. And here it is important to understand when we should seek medical help and when we can stay at home. So, if after an injury we have the following symptoms. The first is vomiting that does not bring relief. The second point is when the child or adult is constantly lethargic and keeps sleeping. They have impaired coordination and a general lack of understanding of the surrounding world. For example, they do not recognize relatives or loved ones, and they cannot perform the functions they used to, such as picking up a cup, writing by hand, or carrying out some other action. Therefore, in such cases, you should immediately seek medical help and undergo the appropriate examination. This could be an MRI or CT scan, depending on what the doctor recommends. If these symptoms are not present, we can safely stay at home, and the main assistance in this case is as follows. The first thing is to apply something cold to the area where you were hit. The second is to rest. The third is to reduce the amount of fluid intake. And you should understand that these symptoms should completely resolve within 10 to 14 days. Throughout these days, the symptoms may change. They might become a bit stronger or a bit weaker. But again, if they keep getting worse, then we need to seek help again. If, as I said, a child hits their head, there's no need to panic and immediately call an ambulance. Just observe them for a while. This is extremely important. But there is another group of causes that are not related to trauma. And here mainly this group, it manifests as a headache, and the intensity of this headache can vary from mild to severe, which is called a migraine. And it can even be accompanied by epileptoid seizures and so on. So why does this condition occur? But as we discussed, there are no pain receptors in the brain itself. So why does a headache occur? What causes it? Is it a malfunction of our brain? No, it is all directly related to the swelling that occurs in the brain tissue. And it is the swelling that creates increased pressure and presses on the brain's protective membranes. And it is precisely the pressure on these brain membranes that causes the sensation of headache. Remember, once again, the brain itself does not hurt. The pain occurs because the water, the swelling, directly presses on the brain membranes. We already know that every organ, every tissue, every cell of our body is controlled by the brain. So, for example, when the healing process of the mucous membrane occurs, say in the bronchi or the nasal mucosa, what happens there? Inflammation, which is accompanied by swelling. The same situation occurs in the area of the brain that directly controls this part of our body. Swelling also appears there. Therefore, for example, I want you to first understand that the headache you experience when you have an acute respiratory viral infection, or when you have bronchitis, or when you develop pancreatitis is not an attack or intoxication, as we are often told, but rather swelling that occurs in the control center of the brain responsible for that specific organ. And this can be very easily verified with the help of a CT scan. And the degree of this swelling directly correlates with the intensity of the headache. And the first mistake people make, often following doctors' recommendations, is that when you develop an illness accompanied by inflammation, you are told to drink more water to reduce intoxication. This will only further increase the swelling in the control center at the level of the brain, and your headache will get worse. Not because there is something wrong with your brain, but because in this way you increase the amount of water in the control center that is healing, and it mechanically puts more pressure on the brain membranes. That's why you have a headache. The next early symptom is that we may start to forget things. And for example, we might forget whether we locked the door, right? Or for instance, whether we turned off the iron, or we might even temporarily forget what we were doing. And very often we say, oh, be careful. These are the first signs of problems with the brain. These are symptoms of Alzheimer's disease. And people, upon immediately hearing such a diagnosis, say, oh, that's it. Our brain isn't working well. It's forgetting things. We need to do something. And here you need to know one very important thing. This change, which disrupts, which is associated with impaired memory, what is happening now in your everyday life, is not due to your brain functioning poorly, but rather it is a protective reaction of the cerebral cortex. When a person loses contact with someone close to them, for example, a grandmother moves from her village to the city, her daughter takes her in, and now she no longer lives where she felt very comfortable, and she has lost contact with that familiar and habitual place. And now, in order to forget this biological trauma, the brain activates a defense mechanism. The grandmother starts having trouble remembering things. She remembers what happened a long time ago, but now she can't remember things in the present. Or for example, a young child moves from one school to another because their parents relocated, and the child lost contact with their former classmates. And suddenly, for some reason, their memory started to get worse. And now for some reason, they started doing poorly in school. Oh, that's just the brain not working well. It's lacking vitamins. It needs to be stimulated. No, this is a protective reaction. So please remember, if memory gets worse, it is not a disease. It's just that this person ended up in a situation where they lost contact with those close to them and their familiar environment. So if you don't restore that, this protective reaction will keep working. And in this case, no vitamins, no techniques, no medications will help. Because remember, once again, this is a protective reaction to forget that traumatic event, which was significant for the person. Not from your point of view, but from the person's point of view. So for example, if this grandmother did move to that city, you need to create comfortable conditions so that she can feel at home. The same rug, the same cup, and so on. The same goes for a small child, so that they can communicate with their peers, maybe see them from time to time. Only this makes it possible to restore contact. But if you say, what if the person has died and now it's impossible to restore contact, what should you do then? Well, then you need to provide that warmth, that tenderness, and that love for this person so that they feel the same sensations as before. And only then will the defensive reaction turn off. And only then will memory begin to recover. Another vivid example is that we have migraine attacks. They say, oh, that's it, my head isn't right, it's kind of stupid, it starts to hurt a lot. Some people have it with aura, some without aura. And this migraine is constantly being treated, and no one can cure it. Nothing will work. For one simple reason, the approaches are incorrect. A migraine attack, it's not a disease, it's not a dysfunction of the brain. In this particular case, it's essentially a biological mechanism, a natural way to effectively get rid of excess fluid within the brain tissue. So consequently, when the swelling became very intense, the initial mechanism, the very first response, is to trigger a significant and intense headache in order to facilitate the removal of that excess water. How does this happen? First, the sympathetic nervous system is sharply activated and this water is released, and then the parasympathetic system is activated, causing lethargy. So what should you do when a migraine attack occurs? Once a migraine attack has started, there's nothing you can do. You need to do this beforehand. First of all, never lower your self-esteem or think that your brain is somehow malfunctioning or anything like that. Any thought like, oh, my head isn't right, or oh, it's making a mistake, or oh, I'm doing something wrong, will already start to change how your body functions. Why is that? Because for your brain, it doesn't matter whether you're just thinking about it or it's actually happening. So remember, all your thoughts are perceived as real by your brain. If in your thoughts and in your perception of the world you diminish your own importance or consider yourself somehow not good enough, flawed, or unable to succeed at something, then you will find yourself in such situations to a greater or lesser extent. The more intense the headache, the more self-devaluation there was beforehand, both intellectually and towards others. So what should you do? What you need to do is always praise yourself. And every decision you make in your life and every decision you have made is the right one for that particular moment, that particular second of your life when you made it. The next second or minute, you will have new information, and that new decision will not be misunderstood by anyone. It will be the right one for that time. And the previous decision was right for the time in the past, so you never actually make mistakes. This is extremely important if you live by this concept. Also, reduce your fluid intake. Additionally, when you have an intense headache, take diuretics. Mainly, these should be herbal diuretics, and you should apply ice to your head. This will help reduce migraine attacks. Of course, sometimes it may be necessary to use medication just once. But please remember, if you treat a headache, a protective reaction, as a disease that has attacked you, you will never get rid of it, and you won't break this cycle. Another symptom that people are very afraid of is epileptic seizures, because epilepsy is considered a very frightening and incurable disease, and it is believed that we constantly need to take medication for it. But why does epilepsy occur? Because foci develop in the brain. And why did these foci appear there? The answer is very simple. It's what you see on a CT scan or MRI. They show you and say that these are the foci that excite our nerve receptors, and then these impulses are transmitted to the muscles, and that's how this terrible disease develops. This is also a healing process of our body, strange as it may sound. An epileptic seizure is actually a healing process of the skeletal muscles. So, when our skeletal muscles are healing and there is also swelling in them, in order to remove the excess fluid from the skeletal muscles, you need to experience these kinds of twitches. They can be small fibrillar twitches when you're just sitting at home and you feel a certain area twitching and you think, oh, my muscle is twitching. Why is it twitching? This is actually the process of the muscle getting rid of water, because the healing processes in it have finished. If a large area was involved, you will experience what is called an epileptic seizure. So what conditions does a person need to be in for this epileptic seizure to occur? This is called the process of getting stuck. For example, a child might feel stuck in school, knowing they have to study there for 12 years, or a person might feel stuck in certain family relationships, or say someone gets into a taxi to go home, but the driver takes a wrong turn. And this is a young woman, and now, for example, she can't open the car door. At that moment, she is stuck. She can't escape from there. It's the feeling of being stuck in a certain place or with certain problems. And then, when she is freed from this, the next day, what happens? An epileptic seizure. The seizure itself, when a person doesn't understand it, can be perceived as, I'm stuck with these symptoms and can't escape from them. And there will also be constant epileptic seizures. That's why epilepsy is not a disease. Epilepsy does not indicate a brain disorder, as we are often told. Epilepsy is a process of releasing fluid both from the brain and from the muscles. So what should we do to prevent epileptic seizures? The first thing is to drink less water. We've already talked about this. And the second point is to identify those moments that a person perceives as being stuck and remove these elements from their life. And then epilepsy disappears. It's not pills that save you here, but a change in lifestyle and understanding how the body works. There are also often so-called neurological manifestations when, for example, in addition to having a headache and the other symptoms we've already mentioned, a person may lose their vision or visual acuity, or, for example, the function of an arm or a leg may be impaired. Of course, we're not talking about strokes right now, but people are afraid of brain tumors, thinking these could be the first signs of a brain tumor and they don't want to miss it. But there's one very interesting fact. In medicine, it's accepted that brain cells themselves do not divide, but a tumor is considered to be the result of cell division. So how is this possible? What kind of paradox is this? The paradox lies in the following. Indeed, the brain cells, the control centers, do not divide, but what can divide is the so-called connective tissue of the brain, which is made up of astrocytes. That is, in the brain there are actually astrocytomas, glioblastomas, and so on. But all of these are just different descriptions of the same substance. This is essentially the connective tissue of the brain, so why does a tumor arise? And that's because when a constant healing process occurs, remember those centers we talked about, the amount of this substance keeps increasing. We end up with a formation that we call a tumor. What is this doctor talking about? Can this be verified? We can check this analogy on our own skin. For example, when we injure our skin, or a muscle for instance, what forms here? Connective tissue. If you keep injuring that spot, the scar will keep getting bigger and bigger over and over again. And often, for example, it can even be called a keloid, meaning an overgrowth. The same thing happens in the brain. With constant repetition, this tissue will continue to grow. This is what is called a tumor. So, when we understand that changes at the level of the brain are connected to the overgrowth of this connective tissue, which swells and causes symptoms like headaches, epileptic seizures, vomiting, and so on, and that these are related to mechanical pressure, what should we do? Of course, a neurosurgeon will say that surgery is necessary, and in some cases, surgery is indeed needed. But in most cases, we simply need to reduce the swelling. And to do this, once again, we need to reduce water intake. We need to take diuretics and medications that act specifically at the level of the brain, which prevent the brain, or rather the swelling, from developing. There are such medications in medicine, and they are called dexamethasone, but you must not take it on your own. Only a doctor should prescribe it. Therefore, when we take a combined approach like this, we can help these people. And most of these people can even manage without surgical intervention. Therefore, in fact, the main rules for helping our brain when there is swelling are first to reduce fluid intake for adults to 300 to 500 milliliters per day. As for children, let them drink as much as they want. You shouldn't force them in this regard. Next, applying cold to the head also helps reduce swelling. Additionally, taking herbal remedies that help remove excess water from the body. And we can also use medications that specifically reduce swelling in the brain. But these must be prescribed directly by a doctor because they determine the correct dosage. If these symptoms are not related to swelling, but instead we see, for example, memory loss, what we call Alzheimer's disease and similar conditions, then the main task is different. These remedies will not have any effect. We need to address the underlying cause. In other words, we need to help people re-establish contact. We should hug these people, spend more time with them, even 24 hours a day if needed, or find someone who can be with them so that they feel at home. When that lost connection is restored, as I say, then the situation will resolve and their memory will start to return. And in conclusion, you need to understand that the main task of the brain is just one thing: to prolong our biological life on this planet. And now when you already understand how the brain works and why these symptoms occur, you can help it with this rather than fighting against it. And then you will live long and happily, have a good memory, and love on this planet.